Good evening, everyone. 国内的朋友，大家早晨好。On this early summer weekend night, we have the third lecture of the Canada-China distinguished lecture series on mathematics and COVID-19. Tonight, we are very pleased to have Professor Lydia Boroiba from Fluid Dynamics of Disease Transmission Laboratory of MIT. So before the lecture, we are also very pleased to invite Professor Sanjeev Sahara, the Director of Atlantic Association of Research in Mathematical Sciences, to give an opening. So let's welcome.
Thanks very much, Haipeng, and I'm very pleased to be here today and honored today to offer some opening remarks to this great event organized by the Canadian Centre for Disease Modeling and the China Society for Mathematical Biology. So I'm the director of ARMS, which is the Atlantic Association for Research in Mathematical Sciences. It's one of the 4 Canadian regional mathematics institutes. We're the ones that cover the Atlantic Canadian provinces, the ones on the right: New Brunswick, Prince Edward Island, Nova Scotia, and Newfoundland. ARMS is part of a network of Canadian mathematical institutes that's been coming together recently to address this challenge of COVID-19, especially under the direction of the Fields Institute from Ontario and Professor Kumar Murthy, who's in the audience as well. ARMS has had a long history of supporting math biology through various means, and we're looking forward to this next stage, and we're quite happy to support the Canadian Centre for Disease Modeling and also the Chinese Society of Mathematical Biology in their efforts to address this pandemic. It's a very interesting time to be a mathematical scientist. I've never seen the public so interested in mathematical sciences before. It's truly remarkable. Even my mother-in-law has been asking me about what I've been doing, which is strange. It's a unique time to engage with the public and really convince everybody that the mathematical sciences are everywhere and really reflect everybody's or impact everybody's lives in a meaningful way. So with that, I'll just reiterate my welcome to the event, and thank you all for coming.
Yeah, thank you, Professor Sahara. Next, I will invite Professor James Whatmore. We all know that Mr. R0 to moderate the lecture of Professor Boroiba. So, James?
Okay, thanks, Haipeng. Yeah, it's my pleasure to I'll give a brief introduction to Lydia Boroiba. She did her PhD at McGill, which is important because that's in Canada, in Montreal, not too far away from here, on theoretical and numerical study of homogeneous rotating turbulence, and then decided that she wanted to make some contributions to public health, I guess, so she decided to do postdoctoral work on mathematical modeling of infectious diseases, and went on to, is now an associate professor at MIT, and has founded and directs the Fluid Dynamics of Disease Transmission Laboratory. And from her website, plagiarizing a bit from her website, she wants to elucidate the poorly understood mechanisms of disease transmission through the lens of fluid dynamics. Professor Boroiba is the recipient of many awards, including the Seichuk Ing Tai Prize for Innovative Research in Health Sciences, the Ole Madsen Mentoring Award, and the Smith Family Foundation Odyssey Award for High Risk, High Reward Basic Science Research. It's my great pleasure to welcome Lydia Boroiba.
Thank you. Thanks very much for the introduction and the invitation. Let me maybe turn on my camera now. I think we're allowed to. Can you see me well?
Yes, yes.
Okay, excellent. So thank you so much for this invitation. It's my pleasure to be here. I will, as discussed in the introduction, talk about the intersection of fluid dynamics and epidemiology in this context of COVID-19. And so the goal of the talk is really to give a glimpse of what are the areas and questions that could be addressed through that lens. Why is it important to think about those areas, and how can they connect us across scales in understanding and modeling these processes, particularly very important processes right now pertinent for this pandemic, but understanding disease transmission in general as well. So let me share my screen so that you can also see my slides.
Thank you, Lydia. That was very nice, very informative, enlightening. So just members of the audience, you should see a Q&A bubble or something at the bottom of your screen if you want to enter questions into that, if you have some. Huaiping, did you have a question? You made a comment on the chat there. Was that a question?
Well, I did. I have a question. Hold on. Wow, thanks, Lydia, for the very wonderful talk. Very informative. A lot of information, especially as I told the audience, you see, in the several biological mathematics group. So we are going to learn how to, you see, sniff to see how the virus is transmitted. I do have one question. You see, for this, according to the standard, now you see in Toronto or in Ontario, in Canada, like many places are started to open. For example, like you see now they need to define some rules. For example, not only like you see you have this coughing to spread, but also you have the things in the environment to on the surface. So this is your first step. So can you say something more about, you see, the parks and the conservation area, how this study like can alert not only like human person-to-person social distancing protection, but also in terms of environment?
Right. So you mean you mean let me just go back here. The environment in open space, so basically outside the doors. Yeah. Okay. So I think so here that's true. It's a very important point. So the what I showed you was sort of the source condition, if you will, right? So and then the overall motion in that indoor environment and what would happen to the residual droplets that are trapped in that cloud once it had slowed down. That's where then the outdoor environment starts, the indoor or outdoor environment start interfacing. So if you're indoor or if you're even outdoors, but in a place where there is not that much air motion, so let's say you're in a very dense sort of woods, very low air circulation, then you could have more lingering of the packet that you have basically exhaled in the air for a longer time, concentrated in one area. But now if you are in a space where you have a lot of air circulation, so a very open area with a lot of airflow, low density of individuals, then that cloud is going to be in some sense dispersed, and the concentration therefore at a given location will be lower. So the risks of encountering a high concentration area, that is really what this cloud is also doing. So it's not only just propagating these things further, but it's also keeping them concentrated. So when you're computing a risk, you can no longer think about a dilution in a volume equivalent to the whole space. It's really that you have almost nothing in some locations and then you have a high packet in some location. So at some point you can have a high dose exposure. That will be diminished if you then have very high air circulation, wind airflow, particularly if you are outdoors. So the risks outdoors for low density in the locations where you will have, you barely see the other groups or the other picnic tables, and it's very well vented, there's wind and air, is low not because you don't have necessarily these emissions, but because the dilution rate is such that the encounter with a high concentrated packet will be of lower probability.
Thank you. There's
Yeah,
some.
Lydia, we have a question from Ian Moyle. How does this new model affect mask recommendation? And maybe I can add to that. I was kind of curious if you can say a little bit about these, well, in Canada, we call them community masks. I guess that's probably standard jargon. Lots and lots of variability in how they're made. Are there more important parts, features that your mask should have?
Right. So, so two things about the mask. So, implication about this work. So, number one, in a healthcare setting, so not talking about the community mask, but in a healthcare setting, the implication here, going back to one of the slides that I showed about these mixed recommendations that we have seen from the different agencies, different countries, about what is accurate or appropriate protection for healthcare workers, depending on what they're doing. From these results, it is very clear that that there is not only from our results, but other studies that are coming out since then of the presence of the viral particles in venting, the presence of the viral particles, basically in the air. Whether it's live or not is still open questions that are limited mostly by, again, technological barriers. But the point is, it is not a picture where the big drops are falling on the surface and that's all where you will have contamination. So that means that for a healthcare setting, full of symptomatic potentially subjects that are basically coughing or exhaling forcefully, potentially gagging during certain procedures, you're going to have emissions that are way beyond this 1 to 2 meter rule or 3 to 6 feet that has been discussed in these different countries. And the direct implication of that is that healthcare workers ideally would have as a recommendation to wear the high-grade respirators the moment that they are basically entering the facility or the room of the subjects, even if they're not within that 2 meter or 6 feet distance. And that's for that made massive consequence. Whether we have supplies or not, it's a different question. But in terms of the safety level, that is really something that is the direct implication of this. The second piece then is the implications for the community. And here too, for the community, if we're dealing with asymptomatic subjects, potential silent carriers that are shedding, but not necessarily coughing or sneezing, then the grading, if you will, of the distance that can be reached is as follows. You have the sneezes that have the high momentum, coughs have the second highest, exhalations, talking, speaking are third in line. So we're going from the 7 to 8 meters to maybe 5 to 6 meters for the coughs to about that maybe 2 to 3 meters for exhalations in terms of where the cloud that is being exhaled can reach. So there, in asymptomatic settings, if nobody's irresponsible going out with symptoms, then the social distancing of 2 to 3 meters could be dramatically helped if we are wearing these what you called community masks, simply because that range is still, it's contained even further, not reaching basically that 2 to 3 meters, or even if you're coughing or now sneezing because of allergies while being a silent spreader, you basically are limiting the range of the cloud by having an obstacle in front of it. Now, it's not perfect, however, because these masks are not sealed and they're actually not made typically, even for the high-grade medical masks, to do what I refer to as source control. It's actually mostly for the high-grade medical mask to protect the wearer from the inhalation of the very small particulates. But in these other masks that are basically surgical mask or the community mask that people, bandanas or all of these things that are being worn right now, these are not sealed. And obviously when you're exhaling, you still have things that are coming out because it's not, again, these ballistic drops. It's not just everything's going to be trapped on the obstacle. You have this gaseous cloud that simply is deflected and follows the path of least resistance. And that means that will, if we have a mesh in front of it that's high resistance, the flow is going to be diverted into the path of least resistance from the sides. Now you have losses, obviously, because things can be trapped on the surface of this mask. And you have also a decrease in momentum of the cloud that leaves from the sides because you have had this obstacle and deflection. So there is a true benefit in doing it from a fluid mechanics point of view as well, in limiting the range. However, that being said, it's really important to understand that this cannot be a substitute for the distancing itself. So it's not because we're wearing this mask that now I can be closer, because you still have losses from the sides that can still potentially reach that 1 meter, 1.5 meters relatively easily, because you have also other forces at play, including buoyancy forces, the fact that we are always a source of heat, which means that we have the cloud that we're emitting is also advected within our own, if you will, flow. And so you have to still maintain that. Think about it as reinforcing, in some sense, a limited social distancing rule that we have with this 2 meter, which is really not sufficient, but it's practical given sometimes a certain indoor space where you need to have more people. But this would help make this a little bit more effective and not a way to substitute that. Now, in terms of protecting the wearer from inhalation of small particulates that might be lingering, then those masks are not the right one for that. And that's why, in part, because similarly for the flow path of resistance to exit, the flow path resistant for entering is the same. So if I'm inhaling, it's not sealed on the side, even if you had a very high grade filtration material that is really effective, the fact that there is no seal, you are still bringing in flow from the side that can come in, and therefore you have, of course, less exposure, because that there is some level of filtration, but much less than the high grade respirators that should remain the priority of healthcare worker, I should add, but still, therefore,
alert
not again,
updates available.
Sorry about that. My computer is very talkative.
Pardon me.
Okay.
CDM Distinguished Lecture Series on
All right. Okay, so sorry, but it's 10 p.m. I have all the reminders of the day. So, so basically, that's the limitation. So it's really important to use them for protecting others, not thinking that this is going to be really protective per se for us for exposure. But in addition to that, it's really important to not use them as a substitute for the social distancing itself.
Thank you. And we have another question from Hongmei Zhu, which is interesting. If a person coughs in a moving vehicle, will the dynamics change?
Can you repeat the question? Sorry.
So it's a question about in a moving vehicle. So if you're in a car, and I like this one because in New Brunswick, we're now allowed to have passengers, but they have to be in the back seat, which makes no sense to me. But the question here, I think, is the dynamics when if a person coughs in a moving vehicle, will the dynamics change?
So no, so in the moving vehicle, so if you're inside the moving vehicle, the windows are closed, the fact that you're moving is not really changing anything, because basically the motion would be induced by if you had a differential in speeds, right? So if you are, so that's where you would see an effect. So you're still, so now assuming again, you're not having the venting on at full blast and the windows are not open, then inside nothing would necessarily change. So if I'm sneezing or coughing, I still have this forward projection. Now, of course, if I have the seat in front, I would have some deposition on those surfaces as well. And so there too, wearing a mask could be beneficial to protecting the individuals in front, because you're limiting that range. However, if we're talking about now confined spaces where you might have a lot of neighbors to the sides, then if you think about the mask not being sealed, the airflow is leaving from the sides. And so in confined spaces where you might have that distance not being really that large from the neighbors, then the emissions from the side are exposures to the neighbors to your side, right? So depending on what you are doing, how you're interacting with people, you are basically obviously doing a better job at reducing exposure of those you're talking to in front of you, but not those that are on your side, on really adjacent to you. So there is here important management of transportation, public transportation that need to be discussed and thought of, and classrooms also as well when we reopen, with respect to these dynamics of reduction of range forward, but not necessarily sideward.
Huh, that's interesting. And maybe I'll, if you're still up for more questions, and your computer lets you, then another question that's interesting, the climate change from the time of Wells' proposition to now, I guess, does that make any contribution to how fast the infection travels in air?
So you mean from the times that, so climate change with respect to the Wells theory, or?
Yeah, no, I've forgotten the date. That was 1930s?
Oh,
Was that?
1930s, yes. So the climate change, you mean the actual climate change, not the political climate change, you mean the actual climate change,
I
right?
think so, yes.
Okay, all right. No, so right now, so at least from the Wells discussion, we're really talking about the indoor space in that context, and the physics of these drops being, this competition between fallout and evaporation. That's not really. I mean, you can think about, okay, if you really had a very different indoor space where we were at very different moisture levels or temperature levels, maybe the timescale of evaporation could affect the process. But in fact, what we have seen in our more recent work that I didn't talk about is that really the micro environment around these drops in the cloud is very much protected from with respect to the outside average environment in the indoor space. But so indoors, that is not really affected as much. However, in terms of climate change, what we know is that you could have different, potentially eventually increase of precipitation cycles and moisture levels on average. That's at least part of these predictions. So now the question is, if it's not temperature but moisture that is being really affected, that could potentially change in our description the buoyancy of this cloud indoors, outdoors in particular, but also indoors, because the resulting moisture indoors is dictated by the moisture outdoors. And so that's one factor that is a little bit more potentially of influence, but it's really not clear right now that either weather patterns or even differences in climate for the SARS-CoV-2 have any effect in the data that we have looked at. There's glimpses of studies here and there that are claiming that that's the case, but there's in the data we've looked at, it's really unclear.
So actually, yeah, I think I'll take the liberty of being moderator and ask the last question here. And it's related. So, and I think you may have answered it already, actually, but as we start thinking about, well, going into the summer, I guess, but also opening up offices and putting new building codes on, I guess, in light of all this, are there things from the physics and the fluid mechanics side about recommendations for humidity or temperature in buildings that would affect transmission, or at least in terms of the fluid mechanics side of it?
Yes. So that's a really good, really pressing question and good question. So there are no yet clear results about that. But it can affect the process in a few ways. So there's the overall range that I mentioned. So the forward versus vertical, if you will, accumulation of contaminants would be driven by moisture and temperature in the background. However, there are also other aspects about that microphysics of the drops in the cloud that could be affected by these processes. And that's something that we're working actively in trying to answer, particularly for SARS-CoV-2. And so there are ongoing experiments that some other groups have started looking into this as well, but my group is also involved in, and trying to really decipher how that is going to change the persistence of the organism. So we don't have the answers yet, but that's exactly the hope, that to be able to answer the question about how we could adapt within the range of comfort certain conditions indoors is really it's a really pressing question. And then therefore, how many people could you even put indoors given the conditions that would maybe minimize the transmission? And there have been, again, a few studies here and there that talk about the role of humidity as being good or bad, but the data is very patchy right now, and the processes that have been so the results that have been reported don't have really mechanism associated to them, and so it's very hard to understand if it's a variability because the protocols are very different the way the experiments have been conducted, or if there is really truly a mechanism here. And obviously the stakes are high, because if we do give the wrong recommendation, we could make the problem worse. So I know we're trying to accelerate that work, and hopefully we'll be able to give you more answers in a few months. I mean, in a few weeks, 2 months.
Well, thank you very much. I don't see any comments coming from the panel. So, and I think probably a good time to wrap things up. It's way past my bedtime. So thank you very much. Thank you again. And it was a great pleasure listening to your talk. Very informative. Thank you.
Thank you so much. It was a pleasure.
And Huaiping, do we turn it back to you for a closing?
No, in fact, Bert is closing. Thank you. Lydia, thank you for the
Thank you so much.